كل الدكتور ما النت عنده يخربط او شيء تراسله.
ما اعرف بس قصدي كان بدينا حتى نخلص.
عندك رقمه؟ لا عندك رقم الدكتور راسله هو.
لا بس يا احمد اعتقد. نسمعك.
يلا اوكي. يلا اوكي عيني يا احمد اذا هاي اوكي. يلا اهلا وسهلا. هسه كلكم تسمعوني عيني طلاب؟
نعم دكتور.
نعم دكتور. دكتور تسمعنا دكتور؟
اي تسمعوني انتم بابا؟
دكتور الصوت راح، انت سجلت الصوت لو شلون؟
ليش الصوت راح ابني؟ ليش؟
هسه واضح دكتور، هسه واضح، بس قبل شويه راح الصوت من رديت لنا راح بعدين. واضح هسه دكتور.
هسه واضح الصوت عيني؟
واضح دكتور، اذا صار في اشكال احنا نبلغك ان شاء الله.
يلا اهلا وسهلا بكم. الشاشه واضحه عيني؟ الشاشه واضحه؟
نعم دكتور واضحه.
يلا اوكي طلاب اهلا وسهلا. السلام عليكم ورحمه الله وبركاته. Our lecture today about the tumors. The tumor is an abnormal mass of tissue that result either due to the cells divided more than they should be.
دكتور
بلي تفضل.
دكتور العفو عن المقاطعه، بس عندك انت فاتح المايكين فدا يصير صدى عندنا.
يعني هسه شنو اللي تحب المدى شو؟
ما اعرف اكو مايك ثاني مفتوح او شيء دا يطلع لنا الصوت مرتين، يعني حتى على اسم حضرتك مرتين داخل. يعني هل فاتح من جهازين مثلا؟
لا فاتح جهاز واحد بس، فاتح جهاز واحد.
ما اعرف السبب شنو هو.
السلام عليكم دكتور، تسمعنا؟ شنو الوضع اخوان؟
عم تفضل ابني.
دكتور العفو، بدك تشرح شيء؟ ماكو احنا صوت عندنا اذا تسمعنا.
هو الدكتور موجود اصلا ولا شنو؟
لا يمكن طلع محمد. المرتضى واضح عندك؟
زين هسه شلون بالله شنو كل محاضره هيك؟
لا ماكو ساعات الدكتور طلع من
ها؟
سيد اشرحها انت.
ها وين هي المحاضره؟ ايش مرينا؟
تسمحوا لي هسه بابا طلاب؟
نعم دكتور.
نسمع
خلي شوي بعيد.
معك.
يعني ما اعرف قال مرض.
دكتور ما اعرف بس الصوت شوي بعيد يعني مرات يصير مو واضح يعني ما ادري شنو القصه.
مره تقولون مو واضح، مره تقولون بيس هذا، مره تقولون يا ابني يعني كل ساعه غير السيتنج اني يعني كل
لا
ساعه
عفوا دكتور يعني يعني احنا ما نعرف العفو دكتور يعني بس يعني هيك بعد شو نسوي؟
دكتور العفو، هسه واضح الصوت كلش زين هسه، بس العرض ماكو يعني. بس اسوي برزنتيشن ونبلش ان شاء الله. يعني واضح هسه.
result from either cell divided more than they should be, or the cells do not die when they should be. And the tumor may be either benign or malignant. Tumors in an abnormal benign or malignant new growth of tissue that possess no physiological function. This is a very important statement. Possess no physiological function and arise from uncontrolled, usually rapid cellular proliferation. يعني هذا مثل هسه soft. ده تشوفون هاي الصورة واضحة؟ هاي الصورة طلاب؟
نعم دكتور واضحة.
Then the tumor is an abnormal mass of tissue that results of when the cell divided more than they should be, or the cells do not die when they should be, and may be either benign or malignant. And these tumors possess no physiological function and arise from uncontrolled, usually rapid cellular proliferation, like this soft fibroma of the eyelid, was just a type of a tumor. Almost any type of cell or tissue can develop into a tumor. Okay, any cell in the body can develop into a tumor. The tumor size and different there are a lot of differences of a tumor, maybe microadenoma and maybe big tumors. The types of tumors are different types, variety of names according to the either the cell origin or the shape of the tumor or the type of tissue they appear in. Generally speaking, the tumor either benign, pre-malignant or malignant. واضح الصوت طلاب هسه؟ واضح المحاضرة وصوت؟
نعم دكتور واضح واضح.
Benign tumors are remain benign tumors not metastasized, can be removed, and after their complete removal they not metastasize. And pre-malignant tumors may develop into malignancy. There are factors that make these cells pre-malignant, and the malignant cells, they can grow, spread, and metastasize to other parts of the body. So the benign tumors, most benign tumors are not harmful to human health. لكن بالحقيقة when the tumor, according to the site of the tumor, maybe the tumor press on a nerve, or press on, if the tumor press on the nerve, may causing paresthesia, or causing pain, or loss of function of that organ or tissue supplied by this nerve. Also, the tumor may press on the blood vessels, causing either ischemia or congestion, or may cause pain. And if the tumor in the duct, in a tube, like in the small intestine or in the bronchus or in the ureter, for example, it may cause obstruction. Even if it is benign, it may cause back pressure and obstruction. Accordingly, in the small intestine, for example, it's causing intestinal obstruction. In the bronchus, may causing bronchiectasis or hemostasis. In the ureter, also may causing hydronephrosis. For example, of benign tumors like adenoma or fibroid or fibroma, hemangioma, lipoma, the name according to the origin. Hemangioma, for example, sometimes occur in the skin. We call it strawberry marks. These occur in children and may disappear. And after 10 years, if they persist, they may need removal by surgery or by laser, like this child. Pre-malignant tumors, there are a lot of conditions. They are pre-malignant. They are not cancerous yet, but they are pre-malignant, like actinic keratosis. Actinic keratosis due to sun exposure to sun, التعرض لأشعة الشمس بالناس الكبار بالعمر نسميها senile keratosis أو solar keratosis. وهي هاي pre-malignant تصير crusty, scaly and thick in the fair skinned people، يعني الناس اللي هم مو كل السمر يعني خلينا نقول. وهو هذا بالحقيقة may be develop into يعني may progress to squamous cell carcinoma. Other cervical dysplasia. Dysplasia cervical, it means the cervix of the uterus. The cells in the cervix of the uterus may develop dysplasia, and this may progress to malignancy. This is very important. Also, metaplasia of the lung due to smoking. For example, in the bronchi, when they are lined by glandular cells, if they are exposure to smoking or pollution in the atmosphere, may develop يعني transformation. These glandular cells lining the bronchi of the lung may develop into squamous cell and metaplasia.
دكتور يعطيك العفو،
تفضل.
ممكن ترفع صوتك شويه اذا مو زحمه؟
اوكي هسه واضح الصوت؟
هسه واضح دكتور. اي تمام.
دكتور اذا لابس سماعه بس السماعه افصلها لان الخلل بالسماعه.
يعني مو انتم السماعه اذا فصلتها تقولون ما تسمعون بابا.
الدكتور جرب افصل السماعه لان الصوت كلش ناصي، يعني احنا دائما محاضرتك صوتها واضح، هالمره فد مره يعني حتى بالسماعات ما نسمع زين، ناصي كلش.
Okay, leukoplakia, it is a thick white patch may occur in the mouth and in the tongue. These are the segments of these cells. It may be pre-malignant, it may develop carcinoma. It is very important. You should take a biopsy. And the cause of it either mostly it's due to smoking. It needs removal by surgery or by laser. Malignant tumors divide and spread rapidly, and they are metastasized to other organs. And once they are metastasized, they possess damage. There may be damage, usually metastasis to the liver or the lung, or everywhere metastasis either by the blood or by lymphatics or by direct spread, direct invasion. There are different types of malignant tumors, either carcinoma. Carcinoma formed from epithelial cells. For example, carcinoma of stomach, prostate, pancreas, lung, liver, colon, any organ, breast. These carcinoma يعني may occur in adult or at any age. Sarcoma occur in the connective tissue. So the cell origin is different. In carcinoma, it is occurred from epithelial cells. But sarcoma occur in connective tissue like the bone marrow, the blood, lymphoma, leukemia, cartilage, bone, fat, nerves. Germ cell tumor occur from sperm or egg cells from the ovaries or from the testes. Plastoma, these are embryonic tumors. develop from in children and also in adults, but usually in children, like medulloblastoma or glioblastoma. For example, brain tumors, retinoblastoma, tumor in the retina of the eye, osteoblastoma, bone tumor, or neuroblastoma, nerve cells occur in children. Diagnosis of the tumors either due to the symptoms of the tumor may be presented as a mass, for example, mass in the breast, or mass in the lymph node in the neck, or mass in the colon or in the liver, or the effect of the mass. As I said, if there is obstruction, for example, mass in the common bile duct causing jaundice, mass in the small or large bowel may cause intestinal obstruction, mass in the bronchus may cause atelectasis or hemoptysis. So according to the site of the tumor, may causing the effect, or the tumor may possess certain secretions of if there's endocrine tumor. Also diagnosis, we can use X-ray, for example, chest X-ray, because the chest have the vital organs, 2 lungs and the heart, and this may be metastasis to the lungs. Also, we can use ultrasound. It is non-invasive, simple test, without complication, to detect tumors, for example, in the liver or in the other parts of the abdomen. Also, anywhere tumor, for example, the eye, in the neck, in the thyroid gland, in the breast. We can also use CT scan, computerized tomography, or MRI, magnetic resonance imaging. Also, we can use laboratory test because we have tumor markers, certain, for example, carcinoma, embryonic antigens, or other tumor markers. But the most important diagnostic tool of the tumor is biopsy. Biopsy or cytological examination is very important for diagnosis of the tumor. The causes of a tumor, there are a lot of causes of a tumor. Either genetic, for example, familial adenomatous polyposis, hereditary breast and ovarian cancer. These are genetic tumors, xeroderma pigmentosa. That's to say there are family history of these tumors. Or maybe physical and chemical agents, for example, smoking. Smoking causing a lot of malignancy, either malignancy of the lips, of the tongue, or esophagus, stomach, bowel, kidneys, bronchus, skin, bones, a lot of malignancies caused by smoking. Or materials like arsenic, asbestos, benzene, other organs, other chemicals may causing malignancy also. Lifestyle is very important. The habit of the patient may be alcoholic. Alcohol also causing a lot of tumors. Alcohol may develop liver cirrhosis, and this may develop later on in hepatocellular carcinoma, liver cancer. The diet is very important. There are relationships between certain diet and malignancy. For example, gastric carcinoma, more common in Japan because they eat a lot of high salt diet, smoked fish, and also, but colonic cancer, for example, more common in the Western organs, Western countries, in the USA. So the lifestyle and the food is very important as a cause of malignancy. Obesity is very important. There are a relationship between obesity and certain type of cancer, like breast cancer, postmenopausal breast cancer. Those obese patients with big breast may develop cancer. Endometrial cancer, kidney cancer, esophageal tumors. So there are a relationship between obesity and malignancy. In part due to hormonal effect, estrogen, androgen, progesterone, and other part due to inflammatory process of the fatty tissue. Also, the physical inactivity may develop and may be a cause of cancer. Either it has a relation with the immune system and endocrine system. So the over-nutrition is more common associated with malignancy more than under-nutrition. Other causes of cancer are hormones. For example, in the thyroid cancer and bone cancer, estrogen and progesterone have a relationship with the breast cancer. This is very important. Infection and inflammation. من يعرف which infection causing cancer طلاب؟
دكتور الفيروس انفكشن مثلا بستين بار فيروس مثلا، عندك
وبعد
بابيلوما فيروس،
بكتيريا فور اكزامبل، يا بكتيريا ممكن يسوي كانسر.
بايوجين دكتور.
اتش بايلوري دكتور.
عافيه. شو اسمك انت؟ شو اسمك؟ ابو الاتش
حسين دكتور
بايلوري.
حسين.
عاشت ايدك يا حسين. اتش بايلوري نمبر 1 كارسينوجين. عاشت ايدك يا حسين. There are a lot of viruses مثل ما تفضلتوا. اكو اونكو فيروس، اكو هيومن بابيلوما فيروس. هذا is very important في cervical carcinoma، يعني say of the cervix of the uterus. Epstein Barr virus, right, causing lymphoproliferative disease B cell. Nasopharyngeal carcinoma. Kaposi's sarcoma هو relation with herpes virus. Kaposi's sarcoma. Hepatitis B very important also. Hepatitis B and C هذول they develop ايضا بالحقيقه كارسينوما، واكو مع الاسف يعني لحد الان نازلتنا. Human T cell leukemia virus and other viruses. other causes البكتيريا حكيناها احنا قلنا الاتش بايلوري مثل ما قال حسين عاشيدك حسين. وطبعا يعني في الهارزياسيس شيستوسوما هيماتوبيوم اللي يسوي سيكويمبس سيل كارسينوما اوف ذا يوراينال بلادر كان نمبر 1 يعني كوزز اوف سي اي بلادر يوراينال بلادر هو بالهارزيا بالحقيقه. لكن الان بالوقت الحاضر بالحقيقه السموكينج. اوصل الانفلاميشن بحد ذاته هو الانفلاميشن له علاقه بالحقيقه لانه الانفلاميشن in itself important role in the development and progression of carcinoma. Chronic inflammation lead to DNA damage over time accumulation of random genetic alteration in cancer cells. Other causes exposure to radiation either non-ionizing radiation مثل ultraviolet radiation, X-ray, gamma radiation, ultraviolet radiation, sun exposure to sun, ميلانوما وسكين كانسر. تشوفون هاي صورة الطلاب مال هذا اللي سكويما سيل كارسينوما بالسن اكسبوز سكين اند اوفر ذا نوز. واضحة الصورة تشوفوها طلاب؟
نعم دكتور واضح.
نعم دكتور.
تمام.
نعم.
اكو ايونايتنج راديشن مثل تسوي ايضا مننجيوما ممكن ايضا. اكو other rare causes like organ transplantation, maternal fetal transmission يعني pregnant female ممكن تنقل المالجنسي للطفل مالتها للبيبي. هنا هسه كباثوجينيسيس اوف كانسر. الباثوجينيسيس كانسر requires multiple mutations to progress. اول مره يصير بها initiation وبعدين يصير progression. وهذا الميوتيشن اما inactivated tumor suppressor gene. احنا عندنا التيومر سبريسر جين من اسمه. هذا تيومر سبريسر جين يعني اي مالجنسي هذا يسوي له سبريشن. فاذا هذا الجين صار ب inactivation due to mutation راح طبعا يصير develop malignancy. او mutation inactivated DNA repair gene. عندنا دي ان اي خاص للريبير لما يصير mutation ودامج for example due to alcohol or other irritation, inflammation, hepatitis B, C. فهاي لما نسوي دامج للدي ان اي اكو عندنا جين يسوي ريبير للدي ان اي نسميه دي ان اي ريبير جين. فاذا صار الميوتيشن بهذا الدي ان اي ريبير جين وصار به انكتيفيشن ايضا راح it will develop malignancy. او يصير ميوتيشن انكتيفيت دي ان اي ريبير جين او خلينا نقول ميوتيشن اوف بروتو اونكوجين اللي يصير الى اونكوجين. او طبعا بالحقيقه نكتبها several more tumor suppressor gene. اذا يصير بها ميوتيشن. القضيه كلها قضيه دي ان اي وقضيه changes. فالكانسر قلنا disease caused by genetic changes leading to uncontrolled cell growth. احنا السيل جروث مثلا بالباول بالبرونكاس بالسكين اندر كنترول، لكن هذا المالجنسي هو خارج اوت اوف كنترول cannot be controlled. راح يصير عندنا التيومر. فالبيزك كوزز اوف سبريد نون فاميليال كانسر مثلا بالدي ان اي دامج جينوميك انستابيليتي احنا نقول. وامانورتي اوف تيومر due to inherited gene mutation. اكو شيء inherited. اكو طبعا اونكو فيروسز، اكو كانسر بكتيريا يعني فيزيكال انفايرمنت هذه كلها ذكرناها. التوباكو اكو اريتنت موجوده قلنا السموكينج بالحقيقه الراديشن الانفلاميشن هذه كلها lead to formation of a tumor. The spread of malignant tumors قلنا benign tumor cannot be separated, it is only localized. And if we remove it completely, excise completely, ما راح يصير recurrence. لكن الحقيقة المالجنت tumors لا. المالجنت tumors can invade either local invasion, احنا نسميه direct invasion. For example, هو breast carcinoma invade the chest wall or the skin. Or it may spread by lymphatic. Lymphatic, we have two types. We have permeation. Permeation يعني تعرفون انتم lymphatic عندنا lymphatic vessels فهيصير cell by cell يعني خطوة خطوة cell by cell along the lymphatic vessels أو tumor emboli مثل ما يصير any emboli مثل ما يصير الثرومبس وهاي الثرومبس تنتقل عن طريق الفينز. أيضا ممكن يصير هذا التيومر emboli وتنتقل عن طريق الليمفاتكس. أو التيومر ممكن invade due to the bloodstream لما يصير invasion especially of the veins of the capillaries and veins. For example, CA of colon invading the portal circulation and it metastasizes to the liver because the drainage of the venous drainage of GIT to the liver, portal circulation, and from the liver may disseminate everywhere. Or transperitoneal. For example, if the patient have CA stomach. CA stomach is starting in the mucosa of the stomach, and from the mucosa may invade the submucosa, then to the muscular layer, then to the peritoneal layer, and once it reach the serosa and peritoneal layer of the stomach, there these tumor cells may be shedding from the wall of the stomach and may be implanted either in the pelvis, in the peritoneal cavity, or may be implanted in the ovaries. So sometimes the stomach gastric tumor may be invading due to transperitoneal invasion, may affecting the ovaries. And this condition we call it Krukenberg tumor. Krukenberg اسم شخص. So these are the mode of transmission. And as we said, the diagnosis either by the symptoms, for example, patient presented with abdominal mass, or presented with hepatomegaly, or the patient presented with hemoptysis, نيجوح دم أو hematemesis, أو patient presented with jaundice. هذا الجوندس قد يكون tumor بالبلياري duct أو بالبنكرياس causing pressure on the common bile duct. And then either due to symptoms of the effect of the tumor, or and in this condition we do either ultrasound by investigation. By ultrasound we can't find the tumor, the mass, or maybe find metastasis in the liver, or ascites, for example. And radiation, for example, chest X-ray. Chest X-ray is very important and vital because there may be metastasis to the lungs. Also, we may need CT scan, computerized tomography. We may need, all of these we call it radiological investigation. The ultrasound, the CT scan, the MRI, magnetic resonance imaging. But the most important diagnostic and the proof of the tumor malignancy or benign is the biopsy. We do either direct biopsy or we do fine needle aspiration. Fine needle aspiration by needle, 21 to 22 gauge. We insert it into the tumor, maybe under ultrasound control, and we take cells. We call it fine needle cytology, FNA. FNA, fine needle, A aspiration cytology. إما cytology أو biopsy أو true cut biopsy. True cut we take a tissue biopsy. And this is the most important to prove of the tumor. And after that we do assessment of the tumor. Is it stage 1 or stage 2 or stage 3? The staging of the tumor, it depends on many criteria. The most common staging of the tumor is what we call it TNM, T for the tumor, and N for the lymph node, and the M for the metastasis. So TNM, the tumor the tumor size, for example, tumor of the breast, CA breast. In the TNM, for example, if the tumor less than 2 centimeter, it is T1. If it is from 2 to 5 centimeter, it is T2, and so on, T3 and T4. And the N lymph node, if there is no lymph node involvement, so it is N0. If there is what we call it sentinel lymph node, the nearby, we call it N1. It is more in the axillary or supraclavicular, N2 and N3 and so on. And the M for metastasis. M for metastasis. Either M0, there is no distant metastasis. For example, it is CA breast, but it is metastasized to the liver, or metastasized to the bones, or to the vertebra, or to the brain, or to the lungs, or to the pleura, causing hemothorax. So this is the distant metastasis. So TNM. واضح طلاب شنو TNM؟
واضح دكتور.
تمام. So these are the staging, and the grading of the tumor. The grading is different from the staging. Grading the simulation of the tumor to its primary source. If the tumor is simulated as similar to the يعني origin, we call it يعني grade 1. But if it is unlikely, for example, we call it undifferentiated. يعني إما مثلا well differentiated, هذا well differentiated يعني it looks like the cell origin, well differentiated. هذا good أو يعني good prognosis. لكن إذا undifferentiated anaplastic, it is not similar to the cell origin. نسميه احنا بالحقيقه بهيش حاله نسميه anaplastic, هذا bad prognosis. So the other thing is that the treatment options of the tumor, we do either surgery, and in the surgery we do surgical excision of the tumor. We should do radical excision, especially the malignant tumors, and especially the sarcoma. And maybe after surgery or before surgery, we can use even radiotherapy. For example, if it's big tumor, we can use radiotherapy before operation. احنا نسميه داون ستيجنج. The patient قد يكون stage 4 or stage 3 وهو cannot remove the tumor من invaded the chest wall، فنسويهم radiation حتى نقلل هذا الى هو مثلا stage 2 مثلا او stage 1 can be removed. فإذا radiotherapy by radiation مثلا إذا CA brace احنا نعطيهم 5 sessions per week for 6 to 8 weeks radiotherapy or after surgery, after mastectomy. أو قد نستخدم cytotoxic drugs. Cytotoxic drugs either, for example, in leukemia, lymphoma, or in distant metastasis, we can use cytotoxic drugs. Also, we can use hormones, hormonal therapy, in cases of, for example, say prostate or say breast. So these are the treatment options of the tumor. And in cases of benign tumors, even if it's benign, we should remove the tumor. هذا طبعا بالحقيقة هذا هو ال HPV virus, most common infecting the reproductive tract infection due to development of cervical cancer in women. واضحة هاي الصورة طلاب بتشوفوها؟
واضح دكتور.
تمام. وهذا بالحقيقة هو liver cirrhosis. Liver cirrhosis may be due to alcohol or may be due to hepatitis B or C, and this also may develop into breast cancer from regeneration. كل ما يصير regeneration اكو irritation واكو regeneration. فالirritation either due to smoking, due to alcohol, due to inflammation, hepatitis B or C. This inflammation, this irritation causing rapid growth of cells, and this cell division with the DNA may develop into changes in the DNA and the mutation in the DNA and development of malignancy. High here due to asbestos in a cytological site. So chemicals may causing also يعني malignancy like arsenic, asbestos, benzene, and other chemicals. وهذه قلنا الهيمانجيوما اذا هي كبيناين تيومر هذا سكابل اوف يعني هذا هيد اوف ذا بيشنت او البيبي هذا بناين. ممكن هو يعني السنوات الاولى من العمر ممكن تختفي هاي بعمر 7 سنين او 10 سنين، لكن احيانا تبقى وفي حاله يراد لها سيرجري. واضح هسه طلاب؟ عندكم اي سؤال اي استفسار على الموضوع؟
والله دكتور شكرا لك.
عندكم اي سؤال؟ عندكم اي سؤال؟ يلا اذا ما عندكم سؤال احنا عندنا محاضره على السيرجري يوم 13/7 مو تمام طلاب؟
ان شاء الله دكتور.
13/7
شفنا الرابع.
اي على موضوع نعطيكم السمري. انا نزلت لكم اياها المحاضره، موجود احمد